Marco Nunez here, formerly of the LA Lakers, will be the guy to really moderate this discussion regarding what's the title here, Marco?
Training for the future.
For the future. What will performance training and return to play look like in 2030? So you guys ready? Yeah. All right, you got your cafecitos ready. We got, with Marco ready, and I'm going to pass the mic. Let's welcome. Give him a round of applause, please.
Thank you everybody for coming. So real quick, like Erwin mentioned, today's topic for the panel is what the future look like for performance training with a little bit of a dab of AI, obviously kind of involved. So I'm going to give our panel individuals a quick, maybe 30 seconds, 45 seconds to introduce themselves.
Sure. I'm Dr. Martin O'Reilly, the CEO and co-founder of Output Sports, where we have a wearable for strength conditioning and physiotherapy. Prior to launching Output, I did a PhD in machine learning and wearable.
Dr. Phil Harrington, I'm the medical director for Summus Medical Laser.
Athan. So I'm Athan Kollias, founder of Kinvent, 10 sensors to assess and train strength, balance, and motion. It's been 8 years we're in the market.
My name's Rico Rogers. I was a former pro cyclist, and then I created a sleep environment for people to sleep at altitude at their own home, whether it be a bedroom or a pop-up 4x bed system.
Yeah, my name is Emma Meehan, founder, CEO and CTO of KinetikIQ. I'm not a doctor, but I'm a computer scientist, competitive weightlifter, essentially bring my two passions together to bring the motion capture lab into the palm of your hand in real time.
I'm Nick Soto. I'm a strength conditioning coach at University of Miami, specifically with the baseball team. I'm not a doctor or a computer scientist.
So some of the topics or keywords that they kind of mentioned as they were introducing themselves. One of them was real time, kind of mentioned as far as technology right now. And the other aspect of it that we're going to kind of dive into a little bit is the whole aspect of AI involvement in a lot of this performance training, analysis, and technology. All right, so we're going to start with the first question. It's going to be kind of the future rehab and training. So by 2030, how do you envision the athlete's daily training and rehab process involving with the integration of AI, biomechanics, and genetics? Anybody wants to take a dab on it?
Well, I'll jump in first because this is exactly where I think our company vision is pointing towards. So definitely one thing I want to say straight off the mark is you have a lot of I would say sentiment out there that AI is going to take and replace a lot of jobs. I don't think that AI is ultimately going to replace the practitioner. I think what AI is going to do is help practitioners to essentially scale their services, deliver better quality of treatment, and then in terms of how that looks from my own perspective as the founder of KinetikIQ, is that we want to help automate a huge amount of the rehab process so that if a patient, they don't necessarily need to go in to see their PT for every single session. They can be getting coaching at home in real time, and then their PT can know, right, of 100 clients, these are the 10 that I actually need to prioritize for this week and get a real hands-on session where it's at highest urgency and importance, instead of bringing in those who don't necessarily need the hands-on that day, but they can still get super high quality of care at home.
Thanks, and just to jump on that is AI will never replace the gut feeling, that's for sure. And I mean, you try to define the human body like a mathematical model and it's so chaotic that it's actually impossible. And this is where gut feeling comes in. I mean, you see an athlete, you test him, you test them, and you get results, and the AI model is based on some assumptions that you may need to surpass sometimes. And gut feelings are important. The question behind this is, can you actually get that into the system? Can you train the system so that it gets that gut feeling? And the answer for me is no, you can't. And that's why you cannot replace anyone, any practitioner, but you can help them do it faster and more optimized.
I think from a data's perspective, it's going to be a lot better though, isn't it? You're going to be able to weed out the zeros a lot quicker, because at the end of the day, it's reliant on reliable data, and at the moment I don't believe we're quite there with the data. So as soon as that comes up, maybe we'll be able to make more predictive changes with it. It's like from our perspective, we're essentially using Apple Watches, which is for SPO2 at least, and it's not accurate. I mean, it's probably within 5%, but 5% is a huge variation. So, yeah, AI can certainly have a big part to play, but yeah, the sensors are going to have to come up dramatically for that to happen, for it to be meaningful, I would think.
Maybe just add one extra piece of context. I think if you take the whole process of, say, building an athlete, bring them to return to play, there's parts that humans are really good at, and there's parts where technology is stronger. So, for instance, in movement assessment, doing that by eye, lots of research shows that's got a lot of noise, lots of inter-rater disagreements. So, parts where technology are better, I think we're already seeing that come to the fore. But parts where humans are better, like decision making, connecting all the dots, adding the context, that will obviously still be so key to the process. So I think right now we're at like a huge amount of technology and a lot of process around it, but I think it will get refined to technology doing what matters, and then practitioners doing what they do best as well in terms of context and decision making.
So kind of going to what you just kind of mentioned, I guess that's the next, this is not one of the next questions, just kind of veer off a little bit real quick. Is there such thing as too much data analysis on that part when it starts kind of muddling the waters type of thing, where then the practitioner, and we're going to get into the next question, has to get involved in distinguishing, is this data usable type of thing, or are we just kind of veering off the topic or off the subject?
Yeah, so right now, definitely, that's one of the biggest things we're like on my end that we're getting is we're just getting like overwhelmed with all this data, and then companies, trying to give you all these different data points, some of them relevant, some of them totally irrelevant, or just even if they are relevant, how can I use it at my end to make some, make an actionable decision. So one of the big things is trying to narrow down the data. Actually, we were just talking about it with David Gill over there earlier today. There's just so much out there. It's like, okay, what is relevant to my athlete? What is relevant to my athlete that I can control and I can help kind of bring the ball forward.
I agree, and I think there's some organizations in professional sports that I think are actually requiring teams to purchase certain types of technological devices. Whether is it suitable for them, can they use it, can they afford it, do they have the personnel to be able to interpret the information, the data, and be able to practically apply it for the athletes to kind of benefit them. So is there a point where like, hey, we've reached this curve where it's like, all right, we're just hurting the athletes or our individuals, now we kind of have to dive down on it. Okay, next question. We're going to talk about AI, human, and someone already kind of brought up the gut performance. Human versus machine insight. As AI and data-driven tools take on a larger role in monitoring load, recovery, and readiness, how do practitioners maintain the balance between technology-driven decisions and human intuition or experience?
I'll just go and jump in here first because I think most of my fellow panelists are more on the performance and recovery, measuring the athletes and performance and things like that. I'm more on the therapeutic side, more using photobiomodulation to have that positive biological effect on the tissues. And our company, we've been around for 20 years, and we have always, analyzed photobiomodulation research. The big thing that we did several years ago was doing true depth of penetration studies on cadaver tissue so that our protocols, I think we can stand pretty firmly on them. But in looking to the future of devices that we currently have and the devices that we are looking at launching in the market is how do we incorporate AI to measure various biomarkers from the patient or take measurements, and so that we can, right now, to put an accurate dose of laser into a cadaver, that's good and interesting, but in order to deliver the proper dose of laser for each specific individual, that's going to be a tool or an area where we will be using AI to make sure that we are giving the most efficient treatment possible for that particular athlete.
Human versus machine.
Yes, just to say one first thing, that too much data kills data. So if you try to gather anything you can gather, at the end everyone's lost. And the worst thing you can do is also take kids, athletes out of their training session to do testings only to get that kind of data. So that's the first thing that I would like to say. The second is, no, once again, practitioners will never be replaced by AI. What they can do though is get educated to understand that kind of data, because whatever an engine may give them as an interpretation or result, they have to have that clear eye on it. So,
In the same hand, I mean, AI is very good at sifting out the good from the shit data at the end of the day. And when we were cycling, I mean, I was riding professionally when the onset of sort of power meters came about. And you used to say, oh, you know, if you say from a number of 1 to 10 going through your zones, what zone you'd be in, you'd be accurate sort of 95% of the time. And so the power meters were just reinforcing what you already knew. And then does your mind atrophy and then you just rely on the data? If you're a good practitioner, good versus bad, you probably wouldn't just rely on the data, and you'd actually have different markers and that sort of thing. But at the end of the day, it is really good at sifting through it. So a mix of both is where you're going to get the best outcome, I would think.
There's also a balance there as well to think in terms of, well, at what level are the different practitioners working? Because, like, if you're talking about the very, very top elite level, they may not want to have AI influencing their decisions around return to performance, etc. But in terms of data systems to try and make elite level performance decision making into more general population, that's where AI may be able to help a bit more. But I think it's all about, well, are the hallucination rates of the AI any better than in terms of, you know, misguided practice, let's say? So there's some aspects there to be really careful about in terms of data accuracy along with regulation, etc., because it's coming in all kinds of different shapes and forms in different countries around the world as well.
No, I agree with that. I was going to add to that, if you have certain athletes that you got to work with, sometimes you work with a lot of athletes, sometimes you work with a small group, and athletes are going to react differently to the information you give them as well, right? So you got to kind of take that with a grain of salt and understand what information is relevant, not just for you as an organization. Let's say for myself, I have to work under a head coach. There's certain things that he cares about that these guys can do, right, on a daily basis, or as they progress to a more elite level athlete. But then the athlete themselves, they also have certain things that whether they want to be more powerful or more explosive or more whatever it is, or more symmetrical. They have big asymmetries, stuff like that. The data is relevant, right? But it's got to be the right data, and AI is not necessarily going to tell you what that is in particular. So you have to kind of take that with a grain of salt and know what data points you're looking for, know what data points are relevant to your athletes, and then kind of dive deep in that sense.
Like very personalized, individualized.
Whether it be on a team basis, right, from the head coach down, or from whoever's in charge of the organization, and also from an athlete-to-athlete basis as well.
Correct, and that's where the human or the practitioner comes in and it gets involved as far as distinguishing which is the data we're going to be utilizing type of thing. So the data or the AI is more of perhaps maybe like a guideline, or also to justify our findings, right? To kind of validate, which obviously as practitioners, we're all very evidence-based on everything that we do type of thing. Okay, all right, next one. Now we're going to talk about wearables and real-time feedback. Okay, that's kind of very valuable nowadays. Everybody, when you watch football games and basketball games nowadays, you have real-time iPads and stuff like that to try to kind of collect data on that part. So wearable technology is already ubiquitous. But what will the next generation of wearables look like in elite sports?
I'm going to jump in there first. I think right now we've seen in recent years a lot of a move to having more and more holistic measurement, going from initially just step counting to heart rate to HRV. And I think we're going to continue to see that growth into strength, power, movement, biomechanical factors, but also some of those things I just mentioned, like activity recognition and heart rate variability. There's still a lot of room for improvement in the accuracy. So there's going to be better accuracy coming in time, better algorithms, And then on the flip side, in terms of the use of data, the phrase personalization has been used a lot today. And I think right now there's a lot of generic big data insights. But even if you look at things like race prediction models, they're not that accurate. But it's quite easy to build a personalised, accurate race prediction model once you know an individual athlete. So I think it won't be necessarily big data, but personalised insights for athletes based on their own profile and a bigger, more accurate picture of the fundamental data as well.
That's a good point there. And the second one that I would add is not invasive in a sense that to not disturb the flow of training. I mean, why do we do sports? First of all, it's because we have fun, right? And when we do go training and train with Nick, for example, we're having fun. If we have to stay behind the screen to check how we're doing, or if we have to go out of the training to actually do our testing, that's disturbing our flow. And it's not so fun. So let's have fun first. So this is where wearables are going, I think.
Wearables for us is interesting. It's a two-edged sword because obviously with blood oxygen content, in real time for us, we can alter it with your body's variation. Your body doesn't vary that much, but yet accuracy is pretty handy. So if you've got let's say you've got an athlete that's got an SpO2 of 88 and a heart rate of 65 while sleeping, if it's not accurate, that your machines might basically put the room to a lesser altitude. So for now, the wearables will feel better. It'll be a lot better. And they're just not there. But eventually, well, it's a very powerful sort of thing, especially with all of the data that's coming out of it. If you can have that looked at by AI, because at the end of the day, all of our watches and that sort of thing are sending data signals every 1 second. It's a huge amount of data. So Apple's probably got the biggest pool of health data out of anyone. And as soon as they're able to look at that in broad strokes, they should be able to make lots of assumptions, which is also scary for companies. So if you're in a company, or if you work for a company and your HRV is really terrible from starting that company, that company is going to have liability for your poor health. And if you were to have something adverse happen or a series of things, it's going to be bad for them too, I would have thought.
So that's when you reach the point in which too much data is bad data.
Not
It depends for who it is.
Yeah, it's for the companies that they're working for, yes. But yeah, it's a very interesting time. It'll only take one person to really upset the whole thing.
Like one of the things I definitely want to add there in terms of like the progress is like there's always been some kind of compromise, and there always has been in terms of like for our space, we do motion capture. So until now it's been okay, you have to have markers, you have to have a large lab or multi-camera systems. Whereas now, okay, we've now managed to get it onto single device, markerless, but our compromise right now is that range and distance. So it's always like, okay, where am I compromising now, and where can I either leverage other pieces of tech to help with this, or where can I see this going in the future? So that's where we kind of have that optimistic aspect is, okay, it's limited now to an iPad or just within this distance, but from a company perspective, that's where I'm kind of looking towards for the next stage in the future for us.
For us, there's like I guess a couple components, and like I'll touch on kind of the motion capture and stuff like that. For me as a practitioner, if I had something that gave me motion capture along with, let's say I could capture a sprint from a couple different angles, and I could get the force production or RFD or whatever per stride, in combination with stride length or stride frequency, whatever, and then actually look at the mechanics. I could kind of put that together. That can give me a lot of actionable data that I could actually take to the athlete and start working on specific things there, right? You take it into the weight room, and it's not necessarily a wearable situation, but if I had, say, a rack, right? I'm a strength coach, I'm a Meehan, so I'm thinking about racks and barbells. So if you're thinking about a barbell, obviously we have BPT devices and stuff like that that are kind of helping coaches train for certain adaptations or whatever it may be. But now if I had something like that alongside with, let's say every rack had a force plate on it as well. And now I can really dig deep into the data because the BPT is limited on what it can give me, right? But if I'm looking for very specific adaptations to different exercises I can do on a barbell, for instance, then that could also kind of enhance what I'm doing. Again, as a tool practitioner, still going to be a practitioner, still going to make the decision, but that information can really kind of help me guide the athlete in the direction that I want them to go. You know, and then the last part of it is on the field. We have an athlete on the field. Okay, what are you going to put on them that's really going to give me some information on what they're doing? You know, and there's a lot of cool things out there with motion capture. Like there's Kinvent and all stuff on the baseball side. I'm sure other sports have it as well. That now they're starting to look at movement and really break that movement and being able to take that movement and then give you some idea of what kind of force is being produced through it. I am a speed power sport, so I'm really always looking at force production. But looking at this at the motion capture and not only being able to identify, say, how much force is being put on the block, like for a pitcher, but also how much hip-shoulder separation you're getting at the same time. So now getting a movement quality along with force production can go a long way. You know, but if you could find some way to add some wearable that kind of checks stress levels and stuff like that, that could be another added bonus. Again, you got to be able to sort through this information, which would be where AI may come into play.
So kind of going along to what you just commented as far as like your wish list, what you kind of want to be seeing kind of in the future, the technology, whether for your performance type of thing. I know this was one of the questions, the original question, so we're going to go a little bit off the topic here. So usually when it comes to athletes, there's usually three pillars, and I believe there's three pillars for the athlete. There's the performance aspect of the athlete, right? The force plate testing, all that stuff, technology. Then you have the internal aspect of the athlete, where you do blood work, you do peptides, you have all these new biomarkers, sweat analysis, all that stuff. And then you have the third aspect, which I believe is the mental aspect of the athlete, which nowadays has become more popular and popular. Out of those three, which ones do you guys feel has already kind of either reached its data pointer peak, and which do you think companies should start focusing on more?
Let's start there. I think, from my perspective, none of them have peaked. I think all three of those areas, they have their traditional ways of measuring that you might equate to a lab in the case of internal sensing or biomechanics. And only really in the last 15, 20 years have technologies like force plates, wearables, etc. emerged. And I think there's still a lot of growth left in both the intrinsic and extrinsic sensing. And then mental also just has so much growth left for the actual measurement. But I think with all the measurement, it creates a lot of noise, a lot of challenge for practitioners to know what to look at, what's important. And I think that's another area of growth. So you might end up having more sensing opportunities, like suggested by Nick, but then the actual use of that data might be simplified in a big way in the coming years to kind of make it more actionable and more simplified to actually get to what matters. But I don't think anything's peaked yet in terms of the quality of measurement.
That makes a lot of sense. What I would like to point out is that all of those technologies that we're talking about, for now, they're still, let's say, available only for structures like Miami University or like collegiate sports generally. I think the big stake here is how can we make those available and easy to understand, even for let's say high school kids, right? Or for Grandma Michelle that wants to go and have a walk on Sunday afternoon, right? So there's a stake there to work on. And on that one, neither on performance or on the physiological part, we are there.
Which you make a good point on that part, which is kind of interesting because when you have young athletes or young kids, that's when you kind of build the foundations of their movement and their mechanics. And most of the companies are striving to kind of compete or put their product into the professional level and the collegiate level at that point. Yes, they're still utilized there and they're great for injury prevention, injury reduction, and stuff like that point, but it's kind of, you make an interesting point as far as maybe that's where technology or the company should start driving towards more of the younger generation type of thing, kind of build the foundation for these young athletes. All right, so our last final question here, return to play by 2030, so in about 5 years from now. What will return to play protocols look like in 2030? How might data from genetics, AI modeling, and continuous monitoring redefine how we measure readiness and reduce re-injury risk?
Return to play. What a huge subject. You want to talk about it?
It'll be a bit swifter, I would have thought. The genetic play is quite interesting as well. There's so much more research that's gone into it recently. And then with nutrition and the space, it should shorten the recovery time down dramatically. But at the end of the day, we can only repair as quickly as our bodies can produce cells and that sort of thing. There's going to be a point in which repair can't be that much quicker, but we're not even close to it right now. Like, we are miles away. I think we're in its infancy, if even at the start.
You refer to like the internal aspect of it.
Yeah, the internal aspect of it. So let's say you have an injury and then to get return to play, I think we're going to have it vastly different in the next sort of 5 to 10 years.
No, I agree with you on that part, because nowadays, we've always had modalities and stuff like that when it comes to return to play from injuries and assessments and monitoring and all that stuff. But nowadays you have a lot of athletes, individuals that are resorting to a lot of the internal aspect, whether like peptides or stuff like that, to try to kind of speed up the healing process. PRP has been there forever. Stem cells, of course, has been more popular within the last couple of years.
Thanks. One thing I might add as well is, like, there are some companies out there that will claim, oh yeah, we'll help reduce risk of injury, get athletes back to play sooner, which is a great, proposition to put forward. But we all know injuries are super multifactorial. Like, it's very rare there is one cause of this injury and one particular solution. So what I'm very interested to see are these other folks that are trying to utilize AI to bring in all the different aspects, whether that's biomechanics or sleep, or the conditions of the field. Is it raining? How's the athlete feeling that day with their nutrition? Like, all those different aspects are all things to take into account for re-injury, prevention, recovery. So it's, okay, how can AI tie all these together to help give better insights? Because I don't think there's one key solution that's going to be a fix-all for this.
Maybe just add to Athan's point on the last question. I think in elite level rehab in the last 5-10 years, it's been a great move from, like, say, subjectivity to objectivity. Rehab's no longer timeline based, it's based on like objective stage gates and progression into your next phase of exercise. And I think that to Athan's point, I think we'll start to see that at the high school level, we'll start to see it at the clinical level, where it's not assessment by eye, it's not decision making because it's been 2 weeks since you were injured, it becomes objective, and that can help move to like faster rehab in the right cases and slower in those cases too. But a big move to objectivity in the wider field.
Good point there. If we talk about ACLs, let's say that 20 years ago everyone would wait about 9 months to get back in the field, and we have Antoine Dupont in France that's back in 5 months. End of story.
Yeah, but he's the greatest of all time, so.
Rugby. Just one observation that I have is, so I get to travel the world and teach about laser therapy. And one thing that anymore, whenever I encounter a new group of trainers or physical therapists or chiropractors or anything, I'll ask them, how many of you were taught the Rice Protocol, and how many of you still use the Rice Protocol in your practice? And what I show them is a slide of the Rolling Stones in 1978, because most of the people that I deal with were not born before 1978, but they still know who the Rolling Stones are. And in 1978, Gabe Merkin coined the Rice Protocol and gave his recommendations for acute injury recovery. And then I think the year was 2015 when Dr. Merkin did a complete reversal on that and now argues why ice delays recovery. So from the therapy standpoint, there are still some changes in protocols that need to be done. And my advice is, less rice and more laser when it comes to acute injury recovery. So I always try to, maybe that was off topic, but I always try to get that message out, because all of your preeminent doctors, Harvard Medical School, even Dr. Google says that you put ice on acute injuries, and I think there's a substantial body of evidence out there now that that's not the best thing to do.
Correct. No, you're absolutely right. I mean, inflammation has always been a negative word, that you want to reduce inflammation, but as we know, inflammation is the healing process of the body type of thing, so you actually kind of want to allow it to happen, obviously, and make sure you kind of monitor. So with heat laser therapy, that's one of the aspects that you can definitely promote it. Oh, somebody else had something?
Well, Phil, to answer your question, too many practitioners still use RES, unfortunately. Yeah.
Okay, so we have 5 minutes left here. We're going to open up for a Q&A. If anybody has any questions for our panel, just raise your hand. And anything on AI, future? No? Okay. All right. So we're gonna thank our panel. Oh,
It's not, I guess not really as much as a question, as much as it is like a general statement, I guess.
yeah, but
So I'm on the side who would be purchasing some of your services, right? And what I notice is there is a disconnect between the utility and the tools and the APIs. I guess really the industry is very fractured when it comes to APIs and data integration. Touching on AI, I would say agentic AI will be definitely the best case scenario. Camera feeds and then also wearables all connected together, talking to each other. Is there anything that you've seen outside, I guess, Terra AI that would do something or Terra API that would do something where you can work closer together to generate? Because again, as a practitioner with Nick, helping athletes do this, I would like to find ways to better connect all my data together. And in a way that I can justify purchasing all your products if it works. You know, obviously I don't want to get just everything for the sake of everything. I'd rather get the things that are going to work and then also be able to delineate. But if I'm going from your system to your system to your system to your system, and all of it now takes me an extra hour to just go through just try to get some sifting through data, it's just not going to make sense for us. And I see this very heavily. I come from tech, and I see just how well all the other services integrate. And I feel in this space particularly, it's almost a nightmare to work with. APIs and just data integration. I guess I'm going to ask you, how would you guys envision this being fixed by 2030?
Yeah, as like a techie by trade, I'm seeing a lot, like 3 kind of different camps in pro sports right now, which is you have guys that are like really hands-on with their own Power BI, their own Tableau backend systems where they're trying to pull in that stuff manually, which is cool for the customization piece, but you do kind of need someone hands-on, and not everyone has like an analyst in-house. Then if you're kind of existing de facto AMSs, your Kitman, your Teamworks, Smartabase, which is now Teamworks, all these guys who have those traditional APIs, but they are layering on AI. So it's interesting to see where they're playing. But what's also really interesting as well is some of the better funded organizations hiring engineers, computer scientists to actually build their own systems, whether that's agentic or just doing custom APIs. So I definitely think there's a space for a strong winner to come in that, like Terra, let's say, that pulls in from various data sources, it gives you the information that you need. I think it's there, but it's okay, who's going to be the right company to be the forerunner there, essentially, because you have those very different kind of personas, let's say, in the level of depth they want on the data and the kind of pool of athletes that they're working with as well.
And let's see things how they are. I mean, it's a niche market. I mean, let's talk about Salesforce and Google. Have we ever tried to do an integration between the two guys?
So,
And it's not a niche market. Imagine us. There you go. Maybe in 5 years we'll be better. But we're still much better than 10 years ago.
I agree.
so in a sense, what you're referring to, 20 years ago, you had a lot of practitioners in a sports setting, and maybe they hired one data analyst or one engineer. Are we getting to the point that now they're going to be way more data analysis, way more engineers in the team versus the practitioners?
I don't think so, because some teams are hiring, but like they're hiring for one computer scientist that could do the work of 5 computer scientists 5 years ago, because they're using all these AI tools to help them coding now.
We have one more question over here.
Yes, so we've been talking about AI and integration and whatnot. We haven't been talking about data, okay, and the integrity of data. And candidly, AI doesn't work if the data isn't good, right? So, I mean, basically, can you guys talk about your data integrity strategies and how you're going forward? I mean, one of the comments that came up earlier was, we produce a lot of data, and you were talking about hallucinations and whatnot. And I want to, if you want to get into some sort of, advanced analytics or predictive analytics or, AI strategy, the data strategy has to be really important. So I'd like to hear what your data strategies are.
Yeah, I think I'll probably speak for a few of the startups here where, like you say, like if you put rubbish into a model, you get rubbish out. So, we're making more accessible tools across the board, but we fundamentally compare to the laboratory comparators and build our algorithms, actually using AI to make sure that the risk-borne measurement or the video-based measurement is really, really reliable and accurate in the first instance. And that's like, for me, that was like 8 years of research, and then it's an ongoing thing every time we release a feature. And then, we've now been in the market 5 years. We capture about 100 million reps every year, and we can now rely that normative data coming from that, risk models, etc., are based on the foundation of strong information. But if we'd have tried to do that 5 years ago, we'd have too little data, and we hadn't yet got to that point with the accuracy. So it's really, really important to constantly benchmark and then, make sure that what you're doing is valuable. And then important to note that there are areas of sports science and physio where actually you're comparing the subjective process, where things have been done by eye or note-taking, and even like noisy data can sometimes be better than purely subjective. So it's just making sure you have the context of where things are at and how you can improve it as well.
Good job.
Okay, I want to thank our panelists. We have to wrap this up because we have the next one coming up. Thank you guys.